Welcome, welcome, welcome. It's my pleasure today to have a very special person with me because there is something very, very good that she's done. Beenzu was one of my former students, and she did something with us in the college. But I won't talk so much about what she is doing now. I'd like her to introduce herself. And I believe that after you listen to this, you yourself will find opportunity or inspiration to move forward. Let me allow my guest to introduce herself. Introduce yourself, please.
All right, thank you. My name is Ms. Beenzu Malawo. I'm a director of Moonlight Health Services and Training based in Lusaka, Zambia.
Based in Lusaka, Zambia?
Yes.
You mentioned director of, I thought you were going to say I am employed, I work for, now you're a director.
Yes.
You working for yourself.
Yes, doctor.
What are you doing exactly in your company?
We train what we call caregivers.
Okay.
And in UK, I think they're called nursing assistants or healthcare assistants, but we call them caregivers.
Caregivers, okay.
Yeah, we train them in basic health skills in a hospital setting or clinical setting. They're not nurses at all.
Okay.
They're just caregivers.
You are as a nurse, because you're a nurse, aren't you?
Yes.
How did you get yourself into training people in that area? How did the journey start?
Yeah, it started off by, because obviously my nursing career, hands-on on the wards, was very, very stressful. I once got to a stage where I had to run, and I was once a manager in an endoscopy unit, and very, very stressful. So I was thinking how I could branch off and change a career, but within the health sector. So I enrolled at CPA then. You were at CPA, CPA. I did the education and training.
Yes, right.
And assessor's qualification, which I successfully
completed. So in that classroom I was teaching you, you had on the back of your mind to fly out after qualifying and set up your own thing.
Not immediately, but I was thinking I'd be employed firstly.
Okay.
I used to look for jobs as a trainer and assessor.
Okay.
Before I left.
Okay.
But when I visited Zambia, I'd gone there just to do more charity work, like probably provide awareness in non-communicable and communicable diseases like diabetes, blood pressure, and that's how the doors opened for me to set up my own training center, because I saw that need. You saw that need.
At that point, Beenzu was in the UK, where we're doing this interview right now. And how long have you lived in the UK?
Over 20 years.
Over 20 years. So over 20 years of sucking of knowledge, Beenzu decided to go and export it, transfer knowledge as a diaspora person. So diaspora knowledge transfer effectively. So you set up your own company to train other people. For me, I say this is very good because you have had a level of exposure which when you traveled over there, you could see opportunities so easily.
Exactly.
Isn't it?
Yes.
So my encouragement to people that are in the diaspora is that when you have so much on your plate, and if you feel like you want to jump outside the box and do something, just do it. Now, Beenzu, how have they received you there in Zambia with your training?
Very good, overwhelming, and obviously the caregivers course is not really wasn't popular, but we've made it popular now.
You've made it popular?
Yes, because there's a huge gap between nurses and maids. Yeah.
Oh, nurses and maids, a huge gap.
Yeah.
So you went and developed a program that can lift up profile of the maids.
No, just to have assistants who can assist nurses with basic basic skills. Care skills. Yes.
And that's where you come in.
Yes,
and
because obviously infection control. How can a maid, a cleaner, start assisting
without that knowledge?
Without that knowledge. So the quality of care, the standards of care, and accidental deaths, unnecessary negligence.
So your thinking was, here's a qualified nurse.
Control.
Here's a qualified nurse who has all the knowledge. Here is the maid to help the nurses, but they have not much knowledge.
No.
Therefore, you needed to bring them up to a certain level, and you brought in that program for caregivers.
Exactly.
Now, these caregivers, do they only work in hospitals, or they can work in other centers or homes?
They can work in hospitals, clinics, or take care of their loved one at home. This course is not only about working in a hospital. It's about even at their homes.
Yeah, at their homes.
Homes or relatives. In Zambia, we don't have nursing homes of care or care homes.
They're not nursing homes yet.
No, they're very few.
Very few.
Yeah, very few. So people take care of their loved ones without knowing exactly what to do.
Okay.
Yeah, and it's caused a lot of people have learned how to do, do certain treatment without medication. To save
lives.
Lives.
Yeah. Like some sort of primary care kind of
exactly
with knowledge that you're now imparting through your training institute.
Exactly.
That's very good.
Yes.
So here we are.
And we've also, there's maybe we're going to come to that about the job creation.
Job creation.
Yeah.
Okay. Hold that thought. Yes.
Okay.
Very good. So you see the level of impact Mrs. Beenzu Malawo is doing in Zambia. I'm sure some of the influence in terms of the way you think had come from the healthcare sector in England.
Exactly.
Because there is domiciliary care, and these people are trained to go and care for people in their own homes.
Okay.
And when you went over to Zambia, you thought these people, precious people, can be trained. And where did you find information to train them? How did you come up with it?
Well, because of the knowledge I had as a nurse, obviously when I started training, I used to be at a level of a healthcare assistant.
Okay.
So when you start nursing, you start from year one, which is basic nursing training. Apart from, there's a limitation there.
Yeah.
There's a difference between a carer and a nurse. Yeah.
Yes.
So you start with basic skills.
Basic skills, yeah.
And I can do that with my eyes closed.
Eyes closed.
Yes.
Yeah.
Yes. So we built our own curriculum, and when we built the curriculum, we used it independently, and then we had it approved.
Fantastic.
Yes, by Zambia Counseling Council.
That's very good. That's very good. And one of your strengths is because you're also a qualified teacher and assessor.
An assessor, exactly.
That's very important. So,
yes.
What would you tell to people about looking at possibilities of coming on these programs? How strong are these programs from your point of view? How strong are these programs? How have they helped you to get to where you are?
I'm now self-employed because of these two programs. I'm self-employed because of these two programs. I could have gone to Zambia to open a clinic or to set up something else, but because of this training,
and you went into
I wanted to change my career.
Career change within the same knowledge environment,
yes,
but career change.
Exactly.
Giving knowledge than the practice itself.
Exactly.
Fantastic. Now, the other point that Beenzu touched in, that's the one I want to focus on in the next few minutes. Become an employer. How has this become a reality to you, Beenzu? Becoming an employer, job creation. Come on, talk about that one. And
yes,
tell me the extent of your tentacles in Zambia.
It makes me very happy to see that my institution is helping others by getting employed. I'll talk about our employees and I'll talk about the trainees.
Yeah.
When we do presentations, the first time they come, they look like lost. They don't look well kept. They look very miserable. But once they come and start on the course, even back home where they come from, the dressing changes. They look better. They just become very happy people. And then now, after that, when they get employed, it's even a better position for them.
So you're talking about a total transformation, personal transformation.
Exactly.
From the way you appear, the joy reflecting through your face, the dressing, the persona, the outgoingness, because confidence is boosted. Exactly. So there's a lot of outcomes.
Yes.
And I guess even health improves. Because if you're confident, less stress. I think you're a medical professional, you understand how stress can cause a lot of issues. So this stepping out, going into the unknown, which is actually the known, fear is something that causes people not to move forward. Beenzu, after living here 20 years, say, I'm going to just do it. And you made it. Yes. Congratulations.
Thank you.
That's very good. That's very good.
Thanks.
Now, before we go, which towns in Zambia are you operating in?
We started off in Lusaka,
Lusaka.
and from Lusaka we moved to along Great North Road, Kabwe, and Ndola. We've gone stretched out to Solwezi, and we'll soon be going to Northern Province.
Fantastic.
Wapula, Southern Province. We want to be everywhere.
Everywhere, that's very
because
good.
Because this change and this motivation to motivate people should be done countrywide.
Countrywide, very good.
Yes.
Now, here's a question. Why did you think I was a mentor to you? Why did you say a question on the spot? I mean, I didn't do much. Why did you think I was a mentor to you? Because mentorship is something that people talk about, but what did you learn from me?
When you're training me and assessing me, you used to say, Beenzu, I can see you can do more than what you're doing. I remember there's a time we spoke about entrepreneurship. Education and training. You used to assess me as a person who could, you knew that, you encouraged me.
Okay.
You gave me the confidence and said, come on, you can do it.
Fantastic.
You can continue, with your CPD, improve your professional development, and there are many things that you can do with the knowledge you have. So and that's why I'm very grateful, and I've always mentioned you as my mentor, because from nursing, my first degree was political science.
Okay.
And then did nursing, and after doing nursing for a very long period of time, I decided to do the education and training, assessment and qualifications through your institution, and that's what's changed my life.
And it's working. You find your beat.
Yes.
Oh, fantastic. In closing, what would you like to tell other people who are in the UK first?
Okay.
Then I'm going to talk to the people on the ground in Zambia and the other Africans.
Okay.
Inspire them.
Yes, you've heard Dr. Lukomona has told you, I've lived here in diaspora for over 20 years, and there's a time that I thought I wouldn't go back home to work, either work for myself or to work for any other organization. It's a very challenging thing to do, but once you get there, don't give up. Everything you try to do in life is quite difficult, but you just have to persevere. Have the confidence in you, continue persevering, and when you continue doing something and people can see that what you're doing is actually helping others, not only you, then you're going the right direction. So what I can tell my fellow people in the diaspora, whether it's not only Zambia, all over the world, Africa, don't fear to go back and take your skills you've got from here to be either self-employed or to be employed in Zambia.
Fantastic.
Yes.
Now, Mrs. Beenzu Malawo, you qualify to become our business partners.
Thank
no
you.
longer a student.
Thank you.
Congratulations.
Thank you very much.
Welcome to the UK, home from home.
Thank you.
God bless. Thank you.
Thanks.